When I was in Geneva, I met with 10 ministers of health from different countries all over the world, mostly European countries, those that we already have programs with or we will be working with in the future. Many of them, I spoke to them specifically about the reforms that are happening in Ukraine so that they could give some advice or they can give some support for what we're doing and how we're changing. It was a very interesting and a long conversation. I had an hour and a half with the Minister of Health of Poland because they're a similar country to Ukraine, both in size and as well as in their history. And he was telling me some of the things that they did when they did their healthcare reform, financing reform, that they made some mistakes, and that actually he told me that the way that we're doing it in Ukraine is a better way to do it from the old Semashko system to change over into a more market-oriented system where there's a national health insurance. Also, I spoke to the Minister of Health of Georgia, who said that the idea we're doing where we're not privatizing hospitals, but we're keeping them as government-owned hospitals, whether it's local government or national government-owned hospitals, but only changing the way that they're administered internally is the better way to go. Because in Georgia, they went private from the beginning, and they've had a lot of problems. So there was some really good conversations, some really good advice. I went to Geneva because we were voting for the new Director General of the World Health Organization, and because when there's an election such as that, the ministers come to the meeting, to the assembly, World Health Assembly, not just deputy ministers. And it's a really good way for 2 days to have a concentration of, the smartest and the best ministers in all of the world, and you have a chance to meet them. Now, 2 days before I went there, I found out that the Minister of Health of the Russian Federation was going to be her candidacy was up as it's called President of the Assembly. It's basically the person who is the master of ceremonies, the one who sits in the front and announces who's going to speak next. That's basically it. And this year, it fell on Europe. And in Europe, when the European group met together, the executive group of the European representation of the countries that are in Europe in the World Health Organization, the small group of 12, including the Russian Federation, they decided on their own who was going to be representing Europe and take this role. And from my understanding, Russia was told that, the World Health Organization needs more financing. Maybe if you kicked in a little extra financing, you could explore your candidacy for this position. And they kicked in an additional 3% of financing. And now all of a sudden they're chosen as the president of this assembly. So I was told that they were going to be the president of the assembly 2 days before, although they knew about this since March, because they knew that Ukraine would not be happy with this decision. So we, at the last day before I got there, we wrote the speech. We had a lot of meetings when I showed up in Geneva with the World Health Organization. We told them privately that we're against the decision, and they wanted us not to speak. But, of course, we have a right to speak out because we're one of the founding members of the United Nations, and we have every right to give our opinion about what's going on. So I spoke first at the beginning of the assembly and told the views of Ukraine as to choosing the Russian minister as the president of the assembly, a country that has invaded Ukraine, that is part of financing and also part of the actual attack on healthcare facilities, ambulances, healthcare workers. I gave in my speech later, I had a 7-minute speech for the entire assembly in which I spoke of the effects of the war in Ukraine, including there's a Security Council Resolution 2286, which was voted on last year in 2016, that condemns the attack of medical personnel or medical facilities that are obviously medical because they have the Red Cross on them or some other designation showing that they're medical. And I talked about the evidence of how many medical facilities were bombed in Ukraine and how many medical personnel were injured in Ukraine by the Russian Federation military and their proxies in eastern Ukraine and in Crimea. So it gave me an opportunity to present to all of the representatives of the member states of the United Nations what's actually happening in Ukraine, that the war is not over, and that the Russian Federation and its proxies are continuing to attack Ukrainians, specifically to target medical workers and medical facilities, which is, first of all, against the Geneva Convention, but secondly, has even most recently been specifically talked about at the Security Council meetings. At the end of the couple of days that I was there, there actually was the voting for the new Director General of the World Health Organization, and the Ethiopian candidate won from the African candidate from Ethiopia won. So we're excited because he's very interested in rural health care, in HIV and hepatitis and tuberculosis treatment. He worked a lot in those areas, and that's something that we have specific issues with in Ukraine. So the next day I sent him a congratulatory letter, and we're hoping that as we worked very well with the previous Director General of the World Health Organization, we'll continue to have a good relationship with them.